Imagine waking up one day, your life completely upended by an illness you never saw coming. This is the stark reality for millions in Britain, where long-term sickness is forcing people out of work at an alarming rate. But why is this happening, and what can be done about it? Take Roni Jones, a former NHS manager and self-proclaimed workaholic from Cornwall. 4 years ago, she collapsed in her garden, only to be diagnosed with multisystem dysautonomia, a debilitating neurological condition. Once dismissive of those on long-term sick leave, Jones now finds herself among the 2.8 million Britons unable to work due to chronic illness. "I can't even imagine getting up, showered, and out of the house regularly, let alone managing a full workday," she shares. Her story is a powerful reminder that anyone can be vulnerable to life-altering health issues. And this is the part most people miss. The numbers are staggering. Since 2019, there's been a 40% increase in working-age people off work due to long-term sickness, totaling 800,000 more individuals. Work-limiting disabilities have also surged by 30%, affecting 4.1 million people. If this trend continues, the economy could face a staggering £66.3 billion annual loss in productivity by 2030, according to the Centre for Economics and Business Research and Zurich Insurance. So, what's driving this crisis? Here's where it gets controversial. While some might blame a sick note culture, the reality is far more complex. Health issues are hitting the workforce in a pincer-like grip, mental health problems early in careers and musculoskeletal issues later on. For instance, since 2015, the number of 16 to 34-year-olds with work-limiting conditions has skyrocketed by 77%, with mental health issues being the primary culprit for 530,000 of them. Among 50 to 64-year-olds, musculoskeletal problems are the leading cause, affecting 140,000 workers. But mental health remains the single biggest reason for long-term absence, accounting for 28% of cases last year, according to ONS data. But here's where it gets even more complex. The rise in mental health issues isn't just about awareness. Mark Rowland, CEO of the Mental Health Foundation, points to 4 mega trends: reduced stigma encouraging more people to seek help, rising economic insecurity, global shocks like the pandemic and climate change, and the unregulated influence of the digital world. For example, in 2022, at the peak of the cost of living crisis, 21% of people without a prior mental health diagnosis reported feeling depressed due to financial worries. Musculoskeletal problems, on the other hand, are exacerbated by an aging workforce. With baby boomers nearing retirement and a declining birth rate, the median age in the UK has risen from 33 to 40 since 1973. Add to this the crippling NHS waiting lists, 7.4 million cases in August, with 40% waiting over 4 months. And it's no wonder physical health issues are worsening. And this is the part most people miss. Employers often neglect their role in this crisis. In 2022 to 23, 1.77 million workers suffered work-related ill health, resulting in 31.5 million lost working days. Yet, only 29% of organizations provide mental health training for managers, despite studies showing its effectiveness in reducing long-term absences. Claire McNeil of TimeWise asks a thought-provoking question: are we really looking at the quality of work and its role in increasing sickness rates? She argues that employers must offer flexibility, especially for young people managing mental health conditions. But many businesses feel ill-equipped to handle these challenges, according to Jane Grattan of the British Chambers of Commerce. Here's a bold interpretation: the government's £1 billion Connect to Work programme, embedding job advisors in GP surgeries, is a step in the right direction. But is it enough? Other countries, like the Netherlands and Australia, offer financial incentives for employers to invest in prevention and reintegration. Japan even awards companies for adopting health initiatives. Could the UK benefit from similar approaches? As Roni Jones poignantly puts it, "Come live my life for a week. You would break your heart, because I have." Her words challenge us to rethink our attitudes toward long-term sickness and the systemic changes needed to support those affected. What do you think? Is the government doing enough? Should employers take more responsibility? Or is this a societal issue that requires a collective effort? Let's start the conversation.